When I first started in oncology, we only had about 10 drugs to treat patients with. Hi, my name is Susie Weddle. I was an oncology nurse for over 40 years. I've been retired now, though, for over 4 years. I did work my first 10 years in the hospital, and then I transferred to a doctor's office. When I first started in oncology, we only had about 10 drugs to treat patients with, and at that time, the nurses mixed their own drugs and gave the chemotherapy to the patients, and those drugs were used to treat about most of the cancers that we had then. But since then, we now have hundreds of chemotherapy drugs, and we now have more specialized drugs that target different types of cancer, so hopefully it shrinks them better than the chemotherapy. Also, back then, we only had a couple of medicines for nausea, and they worked okay, but a lot of people got very sick, and now today they've got many medicines to help prevent nausea and to treat nausea, so people do have better quality of life while they're on treatment. I wanted to tell you about a couple of my patients that are special to me. One was a young girl. We started treating her when she was about 18 or 19. She had Hodgkin's disease. And we gave her all the drugs, and usually Hodgkin's disease responds very quickly to treatment and goes in remission. But with this young lady, she didn't, and she just kept getting very sick. And so the doctors ended up sending her to MD Anderson in Texas. There she got a bone marrow transplant and went in full remission. And today she's a wife, a mother of 2 teenage daughters, and is doing great. The other patient I wanted to tell you about had kidney cancer, and it had spread to his lungs and his bones. And we had given him chemotherapy for about a year, and he never really responded well. So they stopped treatment, and then when we saw him back in about 3 months for follow-up, his scan showed that he didn't have any evidence of disease. And that was a miracle. And I've seen a lot of miracles in my time as an oncology nurse, and I keep praying for our patients every day that they will get the miracle that they want, that the cancer will shrink or go away. A lot of times we don't get what we ask for, but we just keep praying to God to, grant them the peace and no pain, and that He will take care of them. I have a friend now, my best friend has kidney cancer that has spread to her bones, and she's on treatment at this time also. I have the same prayer for her, that, God will grant her the miracle to take all that cancer away. But if that is not His miracle for her, then I just pray He takes care of her and takes care of her pain and everything, and I will stick with her to the end. Thank you.